Una give me for God, now so the people let me beg. Una give me for God, now so the people let me beg, yeah. Me people them, now one thing I want to know, now but that thing when them call, gonna this big country, yeah. Some people get, they don't care.
Welcome, everyone. We're about to get started here.
I say gonna go give you all that the same thing, you will get, God give for everyone. Elect what you get, just do what you do. We the go, now church amongst
All right, I'm gonna go ahead, Barry, and share screen, and then it's gonna stop music. And so welcome, everyone, and I am going to turn it over to McCain to get us started.
Good afternoon, everyone. Thank you for being here and joining us for the Community Health Equity Initiative Data and Action Workshop. We're going to be talking today. Did someone, I just want to make sure that the interpreter gets spotlit or pinned. Sorry, we're going to be talking today about policy advocacy, and we have some of our partners here as well to share. So excited to jump into that. I'm going to start with just a very brief overview of our initiative. If you could go to the next slide.
And as people, I apologize.
So as we're starting, if you would just share in the chat your name, your organization, and your pronouns so we know who is here with us today. And like I said, our agenda, I'll do a quick overview. We will have a policy and advocacy overview from the Massachusetts Public Health Alliance. Right, yeah, they're now in the Alliance. And then we'll have some stories from some of our partners around using CHES data, an opportunity for discussion in small groups about how policy impacts your work, and then a wrap up and a little bit about how you can request CHES data if you'd like. So again, we're the Community Health Equity Initiative at DPH, and we're talking specifically today about one source of data that you might use for policy and advocacy, which is the Community Health Equity Survey, or CHES. Next slide. And this is our data and action framework. So if you're new to our project, this will be new to you. If you've been to any of our other workshops or presentations, you've seen this before. But it's a visual representation of the framework we use for data and action. It's presented here as a circle with gears, understanding that it's often a cyclical process, but we think about defining the issue, analyzing and interpreting, prioritizing based on those analyses and results, and then acting and evaluating. And in the center of all of that is a focus on equity, voice of those who are impacted, and power sharing. And the goal is positive change. Next slide. And then just a brief overview of the Community Health Equity Initiative and our foundational pillars. CHEI promotes the health of Massachusetts residents and reduces health inequities through a health equity data and response system. And I'll quickly go through the three pillars. So the first is the health equity data system, and we use a mixed methods approach. So we use the community health equity survey, and we also work with community evaluators to do some qualitative data collection. We have an equity focus. We collecting data along the health inequities pathway, including health to root causes of health inequities. We center community, and we focus on communities that are often underrepresented in public health data. And we're focused on actionability and timeliness. So we gather data on current public health priority areas and identify need and potential areas for public health action. This is a list of our communities of focus. As I mentioned, we center communities that are often underrepresented in data systems and most impacted by health inequities. And they are listed here, including older adults, parents and caregivers of children and youth with special healthcare needs, parents under 25, people identifying as LGBTQ, people of color, people whose primary language is not English, people with disabilities, people with immigration experience, pregnant people and parents of young children, rural residents, veterans, youth, and young adults. And here are our survey topics for the 2023 survey. So we ask demographic questions, then we ask about safety and social context, substance use, mental health, employment, access to healthcare, basic needs, education, information sources, COVID-19 experiences, and neighborhood. And you can see a copy of our full survey on our website, and we will share that information at the end. Next slide.
Thanks, McCain. So now we're going to hear, and just for introducing myself, I'm Kathleen Zegda. I'm with the Public Health Institute of Western Massachusetts, and we are one of the regional data and action assistance providers for CHES. And so we're going to hear first about policy advocacy from Alexis Walls at the Mass Public Health Association. And then we're going to hear how some organizations are thinking about using data for policy advocacy. So Talene De Silva from the Disability Policy Consortium and Georgia Marlowe from MAPC. So now I am going to stop sharing screen and turn it over to Alexis.
Hello, everybody. It's nice to see everyone on the call today. As was mentioned, my name is Alexis Walls. I use she, her pronouns, and I work as campaign director at the Massachusetts Public Health Alliance. For those who are not familiar, MPHA is a statewide, small but mighty nonprofit that does public health policy advocacy in Massachusetts. And really our philosophy, which I'm sure many of you agree with and understand, is that health is not created in the emergency room and it's not created in the doctor's office, but it's in the social and structural conditions in which we live, work, and play. So we advocate alongside partners on issues that we believe impact the health of communities, and that includes some of the things that were named as a part of the survey. We do a lot of work in particular right now on public health infrastructure, on transportation justice, housing justice, and sustainable food systems. And so I'm happy to be here with you all today. Actually, quick question for event organizers. Are questions coming at the end of every person's presentation, or is that going to be at the very end of the meeting? Just so that I know how much time to leave.
Yeah, so we're going to have questions for you and Talene and Georgia together after each of you have spoken.
Great. That's super helpful. Thanks, Kathleen. So I just want to share a few slides that talk a little bit about how we think about policy advocacy and how data can be used in policy advocacy. Our organization is aware of the CHES survey and is super excited to use some of the data that's come out of it, but have not had experiences utilizing it in the way that some of the other presenters have. So I'll share an example that is not this data, but is another type of data that we've been able to use in some of our advocacy. With that being said, I'm going to share my screen. All right. Alrighty, can I get a thumbs up if people can see my screen okay? Wonderful. Alrighty, so I just want to talk to you all about a few secret ingredients to policy advocacy. So as you all know, policy advocacy is incredibly important, or at least I would hope many of you know who are on this call, because that's what we're here to talk about today. Policy truly shapes the environment around us, and so it's really important for each of you with your own lived experiences and your professional background and expertise to be having conversations with our decision maker so that you can be helping to shape the environment around us. And so when we think about policy advocacy as an organization, there are sort of three steps or a recipe that we like to follow. And so I just want to talk a bit about that. So when talking with decision makers, it's important that we, especially as anyone in the public health space, use plain language to communicate the what, the why, and the how of public health challenges and policy solutions. And so one simple recipe that we like to use is step one, we want to share what the problem is, and we want to emphasize the policy solution. That means we definitely want to go to decision makers and make sure that we're communicating about the problem in a way that they're going to understand it. But we also want to make sure that we're talking just as much about policy solutions if we have them, because that's the thing that we want a decision maker to be taking action on, is the policy solutions that we're bringing before them. Step two, we want to share why the audience, and in this case, it would be decision makers, should care about the issue and the policy solution that you're bringing to them. And we want to use stories and data to do that, addressing both the head and the heart. And step three, we want to share a clear ask regarding how they can support. And so it's not enough for me to go to a decision maker and say, hey, I would love to see you support this policy that will support our boards of health. I want to tell them, hey, can you please co-sponsor this bill? Can you co-sponsor this budget amendment? Can you attend an event in the community to see a little bit more about what your local board of health is doing in the communities that you serve, right? We want to have specifics around how they can be supportive. And so those are our three ingredients. Share what the problem is, emphasize the policy solution, share why your audience should care using stories and data, and share a clear ask regarding how they can support. So where does data come into all of this? How do we bake in the data if we're going to keep going with this recipe ingredient kind of analogy that we have going here? Well, data helps us to build trust and support from policy makers on campaigns that you care about. Data can do three things that I just want to highlight today. One, helps us tell the story of the problem. So when we're using data to communicate about the problem, it can help us to paint a picture of the scope of the issue and who the issue impacts and how. And I have an example of this that I'll show in another slide. Data can also help us build a case for policy solutions. So many of us may be working on issues where a policy solution has actually been piloted at a smaller scale, and there's been data that's collected to show how that policy has actually impacted the people that it's been piloted on. And so when that's the case, we certainly want to be able to share the evidence for how the policy solution addresses the problem that you're raising with the decision maker. And then lastly, I just want to emphasize that data helps us to draw connections to policymakers' whys. So how does a particular problem or policy solution impact people in a decision maker's district? How would that solution address other issues that policymaker cares about? Data can help us draw some of those connections. And so I'm going to share one example, and I'm hoping that it'll be clear. Again, this is not the typical type of data that I think many of us in this space have used. This is more so looking at polling data and how it has impacted one of the campaigns that we've worked on around regional transit. And so One of the big issues that our organization has worked on, as I mentioned, is regional transit. When I talked earlier about our focus being on issues that in the community that impact people where they live, work, and play, we see transportation as a huge issue. One of the things that MPHA, along with some of our partners, had been hearing over and over again from some of our regional public health partners that do work around community health needs assessments is that transportation continued to come up as a big barrier to health in communities. And so we started working along with our partners on a campaign to really try to increase funding for regional transit agencies, recognizing that that would help them improve service, and then that would have a positive impact on communities. And in particular, after the Fair Share Amendment was passed and there was more money for education and transportation in our state budget, we thought that was a great opportunity to try to do some real advocacy around regional transit. And so, as a part of that advocacy, we took some of the data and the numbers that we had been collecting around what regional transit, what the landscape looked like, and then we combined it with some of the polling data that Mass Inc. polling group were able to collect for us by way of a survey. And so this is kind of how we used that information. So I talked about data helping to tell the story around the problem. One of the things that's super important with this issue for us to communicate was what the scope of the problem was. And the scope of this problem was pretty large. We had many communities across 15 different RTA service areas across the state who experienced real gaps in transportation. And so using data really helped us to be able to communicate that with decision makers. We were also able to use some of those numbers to be able to communicate the real gaps that exist. So we were able to communicate around the number of RTAs that weren't able to provide daily service. We were able to communicate around how many RTAs were not able to provide service after a certain time at night. And then also the poll gave us some insight around what percentage of residents thought that bus service near them was good enough to help them get where they needed to go. So that's one of the ways that we really helped use data to communicate and tell the story about the problem. We also used data from this survey to help us communicate around who is actually impacted by this issue. And one of the things that the Mass Inc. polling group found is that when you compare transit ridership in Massachusetts to the Massachusetts population, we saw that transit riders are more likely to be Black, young, and make less than $50,000 a year. And so it really helped us to communicate about the problem. We were also able to use data to help us communicate around and build a case for the policy solution, which was increasing funds for regional transit. We did this by really honing in on just how little of our state transit operating dollars were going towards regional transit, and also asking people what it would take for them to be more likely to rely on and use regional transit, each of which making transit free, making it faster, more reliable, serve more destinations, all of those things which would be made possible by our proposed solution, which is increasing funding for the system. And then lastly, in thinking about helping to use data to connect to a decision maker's why, we try to connect this issue of regional transit to other issues like workforce development and jobs, like healthcare, like shopping and access to healthy, affordable food, and even social isolation and the impact that transit has on people's ability to visit friends and family. And so that's just kind of like a quick picture of how we were able to utilize that data. And in terms of outcomes, once we were able to communicate clearly about the problem with decision makers, once we were able to get on the same page with a coalition about our talking points and how we wanted to talk about the whys of it all, and organize people around campaign activities, we were able to see some really good outcomes for this work, which continues. And that was an engaged statewide network of cross-sector organizations, increased public and decision maker awareness of how RTA service impacts communities, and also increased levels of funding to support RTA service that we've been able to see in the last 2 budget cycles. And that is it for me.
Thank you, Alexis. That was a really great example of how you all have used your framework and used data to be able to illustrate that. As people are having questions, if you want to put them into the chat, and as I mentioned, we'll have some question and answer after each of the speakers are completed their talk. So I'm going to turn it over now to Talene, who is speaking from the Disability Policy Consortium.
Everyone, it's nice to be here with you all today. I'm very excited to share with you how the CHES data is helping us in our work at GPC. So who am I? I am Taline Alonso. I am a sociologist and a research associate at the Disability Policy Consortium here in Boston. I specialize in community-based participatory research methodologies, and I'm working alongside Dennis Heafy and Maggie Sheets on various research projects. So GPC is one of Massachusetts' leading disability rights nonprofit organizations. We aim to amplify the voices of persons with disability on critical issues and promote community health through community-based research, participatory research, and informed policy analysis. We also strive to empower disability advocates to drive change within their communities. Our guiding principle is about us by us, which is the belief that a person with a disability must have a significant role in decisions that affect their lives. The GPC research team primarily engages in participatory research. Community-based research methodologies focus on including the community, in this case, persons with disability, in every part of the research project. So for instance, brainstorming, development of research materials, data collection, analytical process, and so on. So this is to ensure that a qualitative research is driven by the values of persons with disability and that our outcomes are oriented to social action. So how are we using the CHES data to augment the qualitative research we're doing? We are using this data for a project in the community of Springfield in Western Massachusetts. The goal of the project is to better understand the barriers to home and community-based services that may lead to disparities in the institutionalization rates among persons whose native language is Spanish. So this project is better understanding the intersection of disability and language. We want to forward recommendations to Springfield policymakers and advocates about ways to mitigate the rates of people with disabilities, particularly people whose native language is Spanish and who are institutionalized in nursing homes. So our qualitative sample is typically smaller than quantitative sample sizes, and therefore is not generalizable. This is because in qualitative research, we do a more exploratory work. We focus on understanding the deep process of social phenomena to create a narrative. On the other hand, quantitative data is more structured and generalizable. So we are using the best of both worlds. We are using the CHES data because we believe it will not only help us strengthen our qualitative findings, but will also validate our research materials. For example, it will help us create more effective interviews and focus group guides and know better which topics we should be focusing on. Is that housing? Is that employment status? Is that isolation rates? And so on. So we have requested the CHES statewide and Springfield data reports, including demographic variables, age, gender identity, language, level of education, etc., as well as data on access to and barriers to services, because that makes sense to our study. We plan to use both data sets as a basis to validate and strengthen our policy recommendations as well. We deeply understand that response rates of persons with disability may be low and responses rates of Spanish speakers may be lower. But we believe that even though these lower themselves are part of the story driving inequity service access. So we believe that the CHES data is essential in advancing health equity across different populations in the state. And we are very excited to be using that in our research project. Thank you. That's all for me.
Thank you, Taylene. Really appreciate your sharing how you're thinking about using the combination of qualitative and quantitative to support your work around policy change to support people with disabilities. So lastly, we're going to hear from Georgia Barlow, who's going to share an example of data for policy action focused on state policy and school immunizations.
Hi everyone, I'm Georgia Barlow. I use she, her pronouns, and I am on the government affairs team at the Metropolitan Area Planning Council, which is the regional planning agency for the 101 cities and towns in Greater Boston. On our government affairs team, we work really closely with our subject matter expert teams and our planning teams to craft policy using data and research that they do so that it can be implemented on the state level with our legislators in the State House. One thing I just wanted to say to start off is that and I think Alexis touched on this a bit as well, but legislators and elected officials are often elected into positions where they have a wide variety of topics that come before them and that they're making policy decisions about. But it is unlikely that they'll be an expert in more than a few of those areas. And, we want that. We want people who have backgrounds in housing and transportation, who have been in the public health roles and been teachers. But it also is a really good opportunity for us to play a role in helping them craft what those good policies look like. And we really see data and research as a way to bring some of those people up to speed on what those best practices are, what good outcomes could be. So we are kind of see ourselves on our government affairs team as almost like a translation service between elected officials and the experts who are doing that research, doing that data collection, so that we can ensure that accurate information that many people are working on in the field is translated to elected officials so that they really can make those informed decisions. So I shared slides if we could. I'm going to go through a quick example of how we typically go about this and ways that we encourage other people to think about this work. Let's see. I can share my screen.
Georgia, I believe the slides are being shared.
Oh, they are? Okay. I'm just not seeing them. Perfect. So I did want to, an example of work that we have done in the past few years is looking at vaccination rates across the state. I think many public health folks on this call will know that in the past few years, the vaccinations have become increasingly politicized. And this is something that there's a lot of mis and disinformation about. We were asked to work on some data requests from folks in the State House who were looking at childhood vaccination rates in schools and child care centers. So this was a bill that was filed last session. It's been filed again this year, but that would kind of standardize some of those practices for ensuring childhood immunization vaccinations going forward. So if we could go to the next slide. Some of the data that we were originally working with might be very familiar to folks working in the public health field, looking at those kind of broken down by schools, looking at what vaccination rates look like for each types of vaccinations. It's downloadable from the state, but to many legislators who have not worked in this public health field, it was harder to sort through and actually identify what that means for their communities, what new policies mean, what that outcome really could look like. So we worked hand in hand with our data services team to lay some of this information out in a new way. If you could go to the next slide and map it out community by community. We have a searchable website as well that I can share afterwards so that legislators and local elected officials can also see what those vaccination rates look like in their community, so that when they're getting requests from constituents, from people in their community saying that rates are higher or lower than what they really are, we can back that with actual data of what that looks like and understand what, if we were to make some of those policy changes, if we were to change requirements, kind of predicting what those shifts could be like around the state, and ensure that as we're encouraging new policies to be written on that state and local level, that we are using those kind of backed pieces, understanding that full breadth of it as well. There's one more slide looking at the exemptions rate. So looking at it in a few different ways so that we could appeal to different conversations, ensure that we're crafting that narrative that the original data sets are able to give us. So we really see this as a tool to both bolster that information sharing with elected officials to ground some of the policy making in that truth telling and ensure that we're providing that accurate information and kind of level setting the field for people who want to be in this work and helping promote best practices, but might not have that entry point initially. And that is all for me. Thanks.
Thank you so much, Georgia. And so another great example of how data can be used to support policy change and both locally and then also even at a statewide level as well. So now we're going to open it up and see if we have any questions for any of our three speakers. I think, so I'm not seeing any questions. I would ask Alexis, as you're thinking about the policy work that you've been doing and thinking about the many levels of policy advocacy, both whether it's statewide or more locally or within organizations for systems change, are there any suggestions for people as they think of doing this work at various levels?
I think the biggest thing that's coming to mind right now, and I know that I mentioned it a little bit at the top, but just, there are a lot of really smart people on this call who are experts in a ton of different issues or populations. And I think that one thing that can happen when we communicate with decision makers is we assume people know what we're talking about or they understand what certain jargon and words that we use mean or understand the issue. And I think I really would just want to put a fine point on what Georgia just shared around, policymakers being generalists and maybe subject matter expert on like one or two things, but typically they're generalists. And so it is really important for us to be equipping them not just with the data that can help them make informed decisions, but also we serve as translators of sorts, right? Like being able to take complex data sets or being able to take information that maybe we understand and have been able to digest in your various roles and actually translate it so that a more general audience and a legislative audience can understand it. And so I think whether you're doing advocacy using data at the state level or at the local level, that is really critical. And I think that's a piece that I often see missing, especially in public health work. We can be incredibly jargony, and even some of these words that we use that we just assume everyone knows what it means, right? Social determinants of health. These are things that not everyone understands, and so we need to make sure we're using clear and plain language, understanding and recognizing our role as translators.
Great, thank you so much. So we have a question, Viviana.
Hi, thank you so much for the presentation. Alexis and Georgia and the folks doing sharing the data with everyday folks, legislators, residents. What are some good tools to show data visualization? So like Alexis, I thought your presentation, like I could very easily interpret and get what you were saying. And sometimes if this is not your field and you're not working on all these data and how to present it, you may not capture right away what does that mean. So if we're taking data, what are some good ways to turn it into like an easy to digest data visualization way so that everyday folks can like, oh, I get it. Like those bubbles, it took me a moment, George. I'm like, wait, what do these bubbles mean? Is it the bigger the bubble, the more immunization? So what are some good ways to show data? And are there like tools that everyday folks can use? Or who do we go for help? Like if we say, okay, great, this data is beautiful. Who can turn this into something visual that everyday community members can understand?
I'm happy to jump in, Alexis, and then if you want to add it. I think one, I think it depends on the data and the story you're trying to tell. I think one thing we try to do is like on the policy side is try to identify what that narrative shift we want to see and like where our end goal is, because you can get really bogged down in the data. Like what is the story we're trying to tell and that place we're trying to get to with this? So I think there are mapping tools that are available and different pieces, but I think there's the data visualization piece, but I think to us often almost more important is that narrative piece of why we should care and what those high level pieces are that we can share. I don't know if you have specific tools that your team uses, Alexis. I know our data services team works on a number of like mapping pieces that I don't touch as much.
Yeah, no, my answer is going to be much simpler than yours, Georgia. At MPHA, we're a very small, scrappy team. So I think, honestly, I mean, we've used some of MAPC's reports and mapping and data that you all have on your website in order to support some of the work that we do. And so just want to like give like a plus 100 to what Georgia just shared, because I think their team does that really, really well. I think for us, because we don't have, a data team or a research team, our policy and campaign team is a staff of 4. And we don't have that type of expertise. We've relied a lot on learning how to do certain things. Like I know one of my colleagues has done a lot of mapping and like GIS mapping to kind of help people to understand how an issue is maybe impacting a particular district. And I honestly, I can check in with her to see what tool she's used for that. I think it's probably something that's free or very low cost, because that's all that we really have capacity for as an organization. So I can definitely check in with that. I will say, and this is like a very simple answer, but perhaps for folks that are coming from really small organizations where you don't have like a big team that you can rely on, something as simple as Canva can be really helpful and useful. I mean, going back to the basics, right? Like Google Excel to kind of create graphs. Looking at tools like Canva to sort of think about how to visualize what it is that you want to communicate. And I think what Georgia just shared around story and narrative is the really big piece. I think we could probably all find data sets that give us a lot of really good information, but is all of that information what you want to communicate? Or is it like a few things that you want to pull out? Or is it that you want to pull out a relationship between, 2 different issues or 2 different factors, and like how do you make sure you do that in a way that is like simple and clear and easy to understand? And I think certain mapping tools, which I can get from my colleague, and Canva, and just sort of Excel, have been helpful for us. So it's definitely like a scrappy kind of job that we pull those things together with. But yeah, I think that's all that I would add.
Thank you so much, both of
Alex-
you. I do see that there's a question, and right now we also need to move into the breakout rooms that we have planned. So perhaps you can drop your question into the chat, and then we can see about responding to that. I thank you so much to our 3 speakers and for responding to the questions. I'm going to turn it over to Barry Keppard for the breakouts.
Thanks, Kathleen, too. So we're going to go into breakouts, and we hope essentially we can continue this conversation for you to share both your experience, but also maybe ask some questions in the small group around essentially where the data to action, particularly around policy change, connects with your work or work that you find really important too. Before we do so, I just want to ask if anyone would like ASL interpretation support in their breakout room, please drop that in the chat. In that way, as Isabella creates the breakout groups, we'll also make sure that there's an interpreter in that space for you as well too. Thank you, Peggy. That part of it too. So you'll see the 2 questions that Kathleen dropped in there, and then facilitators will also have those questions available to them as well. Isabella, I'm just going to do a check with you. You can either send us right on or let us know if you feel all set.
I'm just going to wait one more moment to see if anyone is adding that they need ASL in the chat. I see that some folks have, but just want to make sure that folks have time. And while I'm waiting, I put this in the chat, but just want to shout out the fact that I'm from the CHEI team here at DPH, and we contract with MAPC and PHI, our data and action support providers, for the purpose of helping you with like having one-on-one data questions, I put an example in the chat of a visualization that the Public Health Institute of Western Mass made about loneliness in Western Massachusetts with CHEI data, but just want to make sure folks are aware that that's a resource as well for you. Okay, I'm not seeing anything else coming through the chat, so I am going to go ahead and open up the breakout rooms.
I imagine doing that, Isabel, too. I imagine we'll go for about 10 minutes. So I have 1:45 right now. We'll go to about 1:55, and then we'll come back as a large group to kind of close out for today.
Okay, that sounds perfect. Meet some new people, see some familiar faces, and make some new connections. I'm going to pass it over to Barry to wrap us up.
Thanks, Isabella, as well, too. And just want to put out my apologies to any folks who may have been cut off if you were sharing. That was a really quick 10 minutes, but to reinforce what Isabella said, hopefully I had a chance to kind of see someone else, hear a little bit about their work, see where we might be connecting around data, the CHES data, but in particular, essentially kind of how the policy environment might change around that too. So just want to encourage you here to follow up to today, and you'll see this in the follow-up email to connect to the Community Health Equity Initiative. Again, I get a lot of chances to work with the Department of Public Health, but this is one that really, again, makes a lot of proactive efforts to connect with folks and to share this information too. So I definitely recommend visiting it. On the website, you can also get access to the data there. So there's a data portal if you're looking for a particular city, particular population, or a particular issue. Definitely go there first. And then one of the really nice things too is you don't have to stop there too. So if you don't find what you're looking for, or you're wanting to see if you can go further, you can always reach out for the kind of one-on-one assistance, and you can do that through that website. And so folks from Kathleen's team, so Kathleen, Rebecca, or folks from the MAPC side too, myself and Tanaya, who's here today too, please feel free to kind of reach out through that portal, and we'll make that connection so we can follow up and talk about that with you too. Please look for upcoming office hours, where essentially if you wanted to continue this conversation, connect with others, that'll be available to folks too. And we'll continue to have monthly webinars. If there's topics of interest, you please also don't hesitate to follow up and let us know about that so we can keep that conversation going too. Thank you very much for being here. I'm just going to check with other folks on the CHEI side and DPH and PHI Western Mass. Any other final thoughts that people want to leave with today?
I did drop in the chat in Rebecca, our feedback form. Included in that form is a place where you could type additional topics you'd like to see in upcoming workshops and webinars. So it will take 1 minute to complete. So please do that.
And I'll also be sending that out as in the follow-up email. You'll be getting the recording, the slides, and that link, as well as a link to check in with us if you have any specific data that you're interested in seeing for your community, or if you want to talk about what it might look like to visualize some data or work to get it in front of decision makers like our speakers today shared. Thank you all so much for being here. We'll have another workshop next month with a new topic and a new set of speakers. So look forward to seeing you back here again soon.
Thank you, Alexis. Thank you, Talene. Thank you, Georgia. Thank you for the work you're doing and the stories you shared today too. Thank you all. Have a wonderful day.